As you know, this is Families in Dementia, where we are providing support, resources, education for caregivers of ones that have loved ones that suffer with dementia. We target our information towards people of color, but of course, we don't stop there. So anyone can really benefit from this information. So today, what we're going to be talking about is the mental health aspect for caregivers. As we've talked about before, right now, especially because of how the baby boomer generation just was really slammed because of the pandemic and are really struggling with a lot of these mental challenges, including dementia. Their children are really having to juggle a lot. I believe they call it the sandwich generation, if I'm not mistaken, where here they're taking care of their parents who are still relatively young, all things considered, kind of your 60s and 70-year-old parents now having dementia, and their children may have families of their own. They may be starting careers, and so they're juggling all of this. So we have an expert with us today who's going to talk about some tips for caregivers, how to maintain your mental health, the challenges that caregiving can cause to mental health, and then just some things that you can do to make sure that you stay mentally healthy. So you guys know I'll talk all day, but I'm going to turn it over and welcome our guest, Sultana Kareem. So Sultana, again, tell just who you are, what you do as far as the mental health aspect goes.
So hi, my name is Sultana Kareem. I am the owner and psychotherapist at Kareem Counseling Services, PLLC. I provide both individual and group counseling to those who are struggling with mood and anxiety disorder, either in pregnancy, postpartum, or other struggles within parenthood. And I also do trainings. I train professionals. I also provide clinical supervision for those who are working towards licensure. I present on topics on racial disparities, perinatal mental health, domestic and sexual violence, and just general mental health too.
Yeah,
mindfulness skills.
So basically, if y'all look up mental health, you should see her picture. Well, I know this is going to be a very a quick, some quick tips that I'm so excited for you to share. So first of all, I kind of said in my intro just the challenges that caregivers have, but can you talk from a mental health standpoint? What are some of the challenges that caregivers of dementia parents or loved ones may be experiencing?
So I feel like mental health intersects all aspects of our well-being. One impact is stress. So they could experience chronic stress of taking care of not only their loved one, but also their relationship with other people and family members. If they're working, if they have children of their own that they're also taking care of, and they're being that constant state of alertness and fight and flight mode, which can drain them over time. Another impact is they may experience anxiety and depression, especially as their family member level of function declines. It's isolating, especially if they're providing care 24/7 to a caregiver, to a person experiencing dementia. They may not have a lot of interactions with other people and isolate themselves, so they'll limit their normal visits to family members or outings. They may not be on the phone as often as they were because they fear something bad is going to happen. They may lose their family member in public, or their family member may have inappropriate behavior in public and don't want to kind of deal with the stressors that come with that in public. The biggest thing is lack of self-care. because they're focused on taking care of their loved one, and oftentimes they neglect themselves. They may not attend their doctor's appointments, or they may not attend to their own eating habits. They may eat unhealthy. They may not do things that they normally would have done prior to taking care of their loved ones.
Wow. Wow. You know what? I would be willing to bet that at least one person, just hearing you say those things, gave them a sense of confirmation, gave them a sense of saying, wow, that's exactly what's been going on with me. Like, I finally feel seen or heard or understood. So thank you for even just breaking that in itself down. Wow. Yeah.
It's
So
hard.
with that in mind, it is. Yeah, it is. It really is. So with that in mind, what are some tips? What are some things that caregivers can do to really make sure that they're taking care of themselves?
So I always like to use the analogy of the cup. And I say that because with a cup, you fill it up with liquids. And that's what you do with yourself when you take care of yourself. You're filling that cup up, and you want to get that cup up to the point it's overflowing. When we give to other people, we pretty much use that liquid that's in that cup to the point that we become depleted. And we don't want to get to there, because that's when we are experiencing the anxiety, the depression, that chronic stress. What would be beneficial is if you continue to fill that cup, and anything that spills over is what you give to others in your life, whether it's the person you're taking care of or other people in your life. I say attend regular appointments. If you before was attending certain doctor appointments every single year and checking on your cholesterol, your blood pressure, and doing all of those things, continue to do that, because that impacts your health, and you get advisement from your doctor of what could be helpful for you. Eat well balanced meals, because sometimes when you're focused on taking care of other people, you forget when was the last time I ate something, or I ate this sweet thing and that's the only thing I ate all day. Being mindful of what you put into your body. Hydrate is also important. Sometimes I think even not outside of the realm of caring for a family member who has dementia, but in general, hydration can help with your mood. Move your body. Some people think of I have to do intense exercising. No, just move your body. Go on for a 5-minute walk. That shift can change your mood. Of I'm tending to myself. This is me time versus a time that I have to take care of someone else. Interact with family members, friends that you've done before to keep that relationship. And that also gives you that sense of belonging and feeling loved by other people. Ask for help. I would say that's the biggest one. Ask for help. Because we could get into the mode of doing everything all by ourselves, or being afraid that we will be a burden to somebody. But there might be people in your life that's willing to, let's say, make you a meal, or make a meal for both you and your caregiver or your family. Or they take out your family member for a little bit so that you have 2 hours by yourself. I would say also do things that you enjoy, whether it's a hobby or interest that you have, or if you don't have any of those, there's plenty to explore to find which one resonates with you and makes you feel good. I have 2 more.
I welcome them. Come on.
Get support by other people who is going through the same phase of life. So a support group on dementia caregivers, because it could provide that normalcy, that you're not alone. Other people understand, and it creates that community. And then last but not least, I would say speak with a therapist to help you process what you're going through, because if you think about the different stages of dementia, the further they are, the harder it is, not just only on your physical
Yeah.
being, but also your mental health. And being able to talk about that.
Yeah. And what's so important, so you hit on at least 3 areas that, when we kind of switch it a little bit and talk about our people of colors, our families of color, right? Some of those areas are already challenging historically for, our culture, right? So addressing mental health in the first place, it can be a challenge. That's, again, not saying all, but very consistently that can be a challenge, for certain cultures for various reasons. So when we talk about first of all, addressing it, you talked about asking for help. Again, I know watching this, listen, I get it. We like to do our own thing, especially in the Black community, proud Black woman, like we do it all, we fix it all. But I love what you said, right? When we talk about that mental health, we have to kind of think outside of the normal behavior we may be used to. Getting those physical doctor checks. I love that. Again, especially, I can speak to my culture, right? Black women, a lot of times we're doing for everybody else, making sure everybody's good, and we are neglecting our personal health. So I love that you said that. And everybody knows I'm team therapy. Please, here's the thing about therapy, as I have this amazing therapist with us today. You don't have to, I always say I'm team therapy for life. What that does not mean that you have to go to therapy every week or every whatever for the rest of your life. It just means that that's a tool in your toolkit that you can pull anytime you need it, right? So especially when there's any major life change, like we said, new diagnosis, or as the disease progresses, that might be time to check in with someone, check in with a counselor, therapist, coach, someone, because it's difficult. It's a difficult illness to watch and participate in. And there's times when it's progressing rapidly. It's also times when it seems like it's okay. And then all of a sudden they're like 5 steps backwards. Right. So I love that you said that. I love the way you listed the steps, because it's so important really to address all of those, but especially those last 3. If I personally can encourage you, please do those things. If you don't do anything else, take care of your physical health, get the help that you need from other people, support, and make sure you're looking into some type of mental health experts that can help you in the process.
Yep.
You heard it right here.
Yes.
Now, Tana, if they want to come see you, yes, it does. Now here, if you're in so we have started our support groups. At the time that you're watching this, they should be in effect. But yes, so of course we have support groups, but find anywhere, any type of group, start your own. If you know of a bunch of people, just get together. It doesn't even have to be like this big professional thing. Have a couple people over for coffee and tea to just talk about what you're dealing with. But if they live in the area, the Prince William County, Manassas, Virginia, DMV area, can they reach out to you to see about getting on your schedule, Satana?
Yes, yeah. So you can reach me on my website at www.karimcounseling.org. You can also reach me on my Instagram, as well as Facebook. Both of them are at Kareem Counseling. So those are the 3 main areas that you can reach me.
Perfect. And I know I've been sending people your way anyway, so hopefully you still have slots available.
Bring them on.
Well, listen, I know you are a busy person, busy mom, professional, so I don't want to take too much of your time, but I really appreciate you coming on and sharing those tips and talking about mental health for caregivers. And again, I make sure the information is right there on the screen. Reach out. think about these lists, at least try to do at least, 2 or 3 of the things that Sultana mentioned to make sure you keep yourself mentally well. Because honestly, you love the person that you're taking care of. You want to see what's best for them, but you really won't be able to do that if you're not making sure that you're actually okay. So appreciate those tips, and thank you for tuning in, and we'll see you next time.